And before I start, does anybody have any questions? So at this moment, everything is clear?
I think I had a quick one, just a clarification.
Okay.
When we were going over chapter 6, when you talked about the peripheral nervous system, you said there's a total of 31 spinal nerves, or is it 31 pair?
Yes.
Okay.
Because look, my dear. Because you can say, well, let's say this is your spinal cavity. Okay. In your spinal cavity, do you have the spinal cord? Okay. Now, what are actually going to form, what you call the spinal cavity, it's actually going to be, it's okay, your vertebrae. Okay. Okay. So pretty much okay. In the intervertebral space, the space between the vertebra, that's where it's okay. At each intervertebral level, yes, okay, the spine is going to give off nerves. Okay. Now these are going to be as okay, what we call it, okay, the anterior from the anterior horns. Okay, which means it's okay will be motor, and posterior is okay. So okay, will also receive. Okay, but generally you can say okay. A sensitive motor cycle, yes, okay, is going to okay be making up one pair of nerves, but it's going to be okay on both sides. Okay, so on both sides, okay, your spinal nerve give off, or your spinal cord, sorry, gives off nerves. So there's going to be a total of 32 pairs. Did that make sense?
Yes.
Okay.
Thank you.
No problem there. Anybody else? Okay, guys. So we're going to talk about is going to refer to as the circle of Willys. Pretty much okay as the circle of Willys, I mean, is going to be, because it's okay, responsible for the blood supply of primarily the brain. Okay, and it's a wonderful structure to look at. Now, not to make it more difficult than it may be, but let's just look at how it is made. Now, yesterday we said that we have the arch of the aorta. Yeah, okay. Just to reassure, this is the right side, this is the left side. Now, the first branch that we had was what we call the brachiocephalic trunk. Next branch was the left common carotid artery. And the third branch was the left subclavian artery. Where we then said that of the brachiocephalic trunk, where we're going to have, okay, 2 branches. One will be the right common carotid artery. And the other branch that it will give off was going to be the right subclavian artery. Okay. Did you guys recall that?
Yeah.
Good. Now, so, but what we mainly as okay can see for sure is that whatever happens to the right and left subclavian artery is going to be the same on right and left side. Whatever happens to the right and left common carotid arteries is going to be the same. It's only as okay their origin that was a little bit slight different, because your right subclavian and right common carotid originates off the brachiocephalic trunk, which branches off the arch of the aorta, where your left common carotid and your left subclavian directly branches off the arch of the aorta. But after this, that's okay. What happens to the right subclavian will also happen to the left subclavian. Or what happens to the right common carotid is also going to happen to the left common carotid. Okay. Now, guys, to mainly as okay, make it simple. We can say as okay that this circle of Willits here mainly as okay is going to be made up of 2 major sets of blood vessels or blood circulatory systems. One is going to as okay come from the carotids.
Sorry, did you say the 2 major sets of blood vessels? Is that what you just said?
Yeah.
Okay.
The next would be that's going to as okay come from as okay what we'll call as okay the vertebral basilar blood vessels. Okay, guys. Now, if we take a common carotid artery, it doesn't really matter which one. Okay, so we said, okay, yes, what did we have? We had what we call the common carotid artery. Now, one thing, guys, and when you see the word common in the name of any artery, for instance, what that mainly is okay will give you a clue of is that this artery at some point is going to branch into XYZ number of branches. Okay, where the name of the artery mainly as okay will just be carried over. Okay, so when we talk of a common carotid artery, that is going to split into 2, or it's going to, okay, what we can call it, bifurcate and give off 2 major branches. Where one is going to be what we'll call the internal carotid artery. And the other one is going to be the Now, if you have an internal, then that's going to be an external carotid artery. So whether it was the right common carotid artery or the left common carotid artery, both of them were going to give off an external branch, and both of them are going to give off an internal branch. Did you guys get that? Yeah, okay. So what I said was that, okay, we had a common artery or common whatsoever name artery. Clue number one is that, okay, when we have the word common, it means, okay, it means that, okay, this artery at some point is going to branch, but the branches that is going to give off is still going to just, okay, carry on this point. Where we can say, okay, the third common is going to just, okay, in this instance, okay, is going to be replaced by internal and external. Now, guys, we're not going to go into much details of just, okay, the external carotid artery. But what we mainly can say is, okay, what this fellow here is, okay, supplies is mainly is, okay, going to supply. You can say it's, okay, structures in the neck and face. Yeah, okay. So that's okay. Things such as, let's say, yes, okay, your thyroid. It's going to just, okay, gets its blood supply from the external carotid artery. Okay. Things such as, okay, as muscles in your face, your lip, your nose, etc., your eyelids, all that. Okay. Going to just, okay, come from branches of the external carotid artery. Did you guys get that?
I'm sorry, structures the what in face?
Structures in the neck and face.
Yeah, thank you.
Okay. Right. So all those structures mean, yes, okay, are going to get their blood supply from branches that, okay, as well branch off from your external carotid artery. Okay. Now, one thing that's going to be important, for instance, if this was, okay, as your common carotid artery, and we say that, okay, yes, it's bifurcates, which means, yes, okay, just is a fancy word for, it's okay, branching into two branches. Okay, and those branches were what we call the internal carotid artery. Okay, and the external carotid artery. So, okay, and where does this bifurcation here occurs? This occurs at the level of cervical vertebra C4. Okay. That's going to be at the level of cervical vertebra C4. Or, well, okay, this is okay as vertebra back in the neck. Clear, okay. So how would you, yes, okay, be able to, yes, okay, on the neck of a person say, yes, okay, where do I find this bifurcation here? So we can mainly say if this is your CCA, here do we have the thyroid cartilage. So pretty much, okay, yes, at the lower level of your thyroid cartilage, is it that this fellow here is going to branch into and did you guys get that?
So sorry. So just to clarify, so the at the thyroid cartilage is where the carotid artery bifurcates.
Exactly.
Separate, right?
Yeah,
Okay.
exactly.
C4, correct?
But when you go back, okay, you can say, well, okay, you can say it's okay. Anterior is okay, that's why we have is okay, the thyroid cartilage. Okay, and it's going to be as okay. At the level of this, that okay, yes, the common carotid artery will bifurcate into internal and external. But if we go straight back like this, yes, back here in the back of the neck, yes, okay, that will be level C.
Okay.
Did that make sense?
Yeah.
Okay. So what we mainly can say is okay, now what we're going to be is okay from the carotid, we can mainly say is okay that the common carotid artery, well, okay, yes, it gave us, or it gave off the external carotid artery, okay, and it gives off the internal carotid artery. And when we said, okay, yes, your circular Willis was formed by us, okay, two sets or two subsets of blood vessels. One of those subsets that's going to just, okay, participate in the production of the circular Willis is going to be the internal carotid artery. Did that make sense? Okay. Okay. And where does the internal carotid artery comes from? It comes from the common carotid artery. Did that make sense? Where did the common carotid arteries come from? Well, the right came off the brachiocephalic trunk, which branched off the arch of the aorta. The left directly branched off your arch of the aorta. Singa. Did that make sense? Did that make sense?
Yes.
Good. Let's give me a second. Next. God remaining says, okay, another set. We're going to get, okay, what we call the vertebrobasilar arteries or basilar blood vessels. So again, let's, okay, yes, look at our arch of aorta. And now we're going to talk a bit about, yes, okay, the vertebral basilar vessels. Oh, we can mean it's okay. Let's call this one here. It's okay. Network. So nothing new. BCT. Left common carotid artery. And we can say it's okay, the left subclavian artery. Now, brachiocephalic trunk gives off right subclavian artery. And okay, so give off right common carotid artery. Okay. Now, guys, the subclavian artery. Subclavian, or some people also refer to it as the subclavicular artery. Now, why is it called a subclavicular artery? We can mainly say that if you say that, okay, this is one clavicle, this is another clavicle. And what we already know is, okay, as here, do we have the sternum? Right. So they are called subclavian arteries, mainly that's okay because they run behind, and it's okay below your clavicles. Now, guys, what these subclavian arteries here will do is that they will give off, one of them will give off one branch each. That is okay, what we need to talk about here, which is going to be referred to as the vertebral artery. Did you guys get that? So this means that's okay, where we can say it's okay that the vertebral part, or what we call is okay, the vertebral basilar network comes from. Okay. So what was it that your right and left subclavian arteries did? They gave off what we can, in this case here, so okay, would be the left subclavian artery, that's our vertebral artery, and okay, the right vertebral artery. Okay, and why are they called vertebral arteries? Well, okay, it's from the word. Well, it's obvious from the name. Okay, that we mainly say that if this was our, let's say it's okay, cervical vertebrae, that the vertebral arteries mainly as okay are going to run up on each side of the vertebral of the cervical vertebra here. Okay. Now what we have on each side of, okay, yes, the vertebra is going to, yes, okay, be what they, okay, some circular processes like these, called the transverse processes. Okay. So yes, okay, if you look at it from above, for instance, this is your vertebra. This is going to be a transverse process. And we can mainly say it's okay that, and in the transverse process, because this means, okay, it's going to be a circular structure made up of bone. And inside that is going to be, okay, an opening called the transverse foramina. So that's pretty much, okay, through is, okay, the transverse foramina on each side of the vertebrae, on top of one another, that your cervical or vertebral artery is going to be running. Did you guys get that?
I have a question.
Yeah,
The right and left vertebral artery, it runs up the cervical vertebrae
Yeah.
through that transverse foramen on each
Exactly.
side.
exactly.
Okay.
Anything else?
No, thank you.
Okay, no problem. Okay. Now, guys, ultimately, it's okay now. It's okay because we have the axis, and okay, then we have the atlas. Okay, and we know that, okay, yes, the brainstem is going to, yes, okay, enter from, yes, okay, the spinal canal or spinal cavity into the cranial cavity. Okay, and what do we find at, okay, yes, because this is going to be, yes, okay, you can say this will be your skull. At the base of the skull, we found that big opening that we call the foramen magnum. Yeah, okay. So what your vertebral arteries actually, as okay, will do is that they will enter into the skull through the foramen magnum. Okay. So let's just make it big here, for instance. Vertebral arteries go up. And we can say here is okay, do we have Mr. Foramen magnum. Is that clear? Okay. And we can make this again. Now we will be, let's make it like it's going to be more realistic. Now we will be inside the skull. So this. What we mainly is okay now we'll have in this area here. Is going to be primarily as okay what we at lower ends will call the medulla. And we can use it this way and say here orbipons. Now let's form this basilar part. And what we actually will see is that, okay, yes, the right vertebral artery. Once they enter into the cranial cavity through the foramen magnum, the right and left vertebral artery actually is okay, will start traveling medially, and mainly is okay, meet one another. And when they meet, they're going to just, okay, continue up. And anterior to the structure of the brain stem that we call the pons. And this artery that mainly is, okay, is formed by the unification or by the union of your right vertebral artery and the left vertebral artery is going to become your, what we call the basilar artery. Okay. And this basilar artery is, okay, that's going to be running anterior to the pons. Did you guys get that? So if you just look at, okay, we can, so now this is going to be anterior, posterior. And we can say, it's okay, here we mainly have the brain. We can say this here is, okay, as your brainstem. We can mainly say, it's okay, here do we have foramen magnum. Now we had, because it's, okay, one vertebral artery, and, okay, that's another vertebral artery. Okay, but pretty much, okay, running like this, but just to this, okay, they would unite. Okay, but before we just, okay, unite them, let's just make our pons. This is going to be, okay, the pons. But when they unite, the right and, yes, okay, the left vertebral arteries, after passing, yes, okay, through the foramen magnum, they become what we call the basilar artery. That, as you see, is, okay, is going to be running anterior to the pons. Did you guys get that?
So after the vertebral arteries run through, they become the basilar.
Basilar. Listen, okay, look here, dear. Right vertebral artery, left vertebral artery. Run here. Enter into the skull through foramen magnum. Did that make sense? Clear? Okay. Now, once they have entered into the skull through foramen magnum, what is that they will do? Come towards the center. From both sides, right? Okay, right from this side, left from this side. Okay, and unite. Did that make sense? Okay. That union is going to happen pretty much, okay, as at the base of the pons and cheated to the pons. And okay, now what do you have? Okay, right and left vertebral artery united. If this is the pons, it's going to just, okay, run and cheated to the pons as one artery called the basilar artery. Okay, so what do you get by the union of your vertebral arteries? A common branch known as a common artery, let's put it this way, called the basilar artery. Did that make sense?
Yes. Thank
Clear?
you.
Okay. Okay. And that basilar artery, my dear, that's going to run anterior to your pons. Clear? Okay. Did you get that?
Yes. Thank
Okay.
you.
How was it formed? By the meeting or union of your right and left vertebral arteries. Did you get that?
Yes.
Good.
Thank you.
No problem there. And guys, we can mainly say as okay, at this point, what do we have? Well, okay. This was mainly as okay, how is okay, this vertebral basilar network was formed. Clear? Okay. So if you may just okay, just start from the bottom and say, well, okay, arch of aorta, brachiocephalic trunk, give our right subclavian artery, which gives out the right vertebral artery. Arch of aorta, left subclavian artery, gives off the left vertebral artery. Right and left vertebral artery passes through foramen magnum, unites to continue as a common artery known as the basilar artery. Okay. And the reason, okay, probably is okay, one of the main points that's okay, that this is going to run anterior to the pons. Because, okay, guys, look here. I know it may become a little bit crowded, that's why it's okay. So if you say that this is the pons, what did we have? We had our vertebral arteries. What did they do? They unite to become what we call the basilar artery. Okay, now guys, as the basilar artery runs by the pons, what it's going to do is it's going to give off branches like this. Did you guys get that? Okay, and what we will call these? Branches that branches off the basilar artery as it runs anterior to the pons are just going to be called the pontine arteries. Where yes, okay, iron is going to be okay, your part. Sorry. Pertaining to pons. But yes, okay, the main is okay, just replaced S with an S. So it became from pons, it became pontine. Clear? Okay. And it's pretty much okay, obvious from there. Its name is okay, what they are going to do. They may is okay, going to supply the pons with blood. Okay. So these will be as okay, what we call the pontine arteries. Which means is okay, are arteries that branches off your basilar artery. Okay. How did your basilar artery come into being? So okay, by the union of your vertebral arteries. Okay, where did your vertebral arteries come from? The subclavian arteries. Okay, and the only difference between the subclavian arteries is okay, the way that they originate or branches off the arch of the aorta. Okay, so what is it that we now have? We as okay, actually as okay, have made as okay over two. We can say it's okay, sets of arteries that now are going to just okay play the role in producing what we call the circle of Willis.
I have a question.
Yes.
So I know we said the external is it carotid?
No, carotid.
Carotid. External carotid artery supplies structures in the neck and face. Did you say where the internal
No,
carotid artery supplies yet?
no, because that's going to be as okay what makes our circle of Willis.
Oh,
Oh,
okay.
oh,
Okay,
okay.
I didn't write that
Okay.
one.
So internal carotid. Okay. Now mainly as okay, just think of it in this way. All these here, yes, okay, what are they? External structures. Clear? Okay. Internal, inside Mr. Skull Knight. Did that make sense? So that's a little cheat. Okay. External carotid. Structures as you see. Internal carotid, okay, is mainly internal because okay, is going to go inside the skull. And what do you hopefully have inside your skull? The brain. Okay. Did that make sense? So your internal carotid mainly is okay, is going to be the part of your it's going to it's okay. We can say it's okay, play a role in supplying blood, or it's okay, becoming a part of your circle of Willis. Okay, which is going to be as okay, the eighth wonder of the world that is responsible for supplying blood to the brain. Okay, but where did your yes, okay, internal carotids come from? They came off the common carotids. Where did the common carotids come from? Right off the brachiocephalic trunk, left off the arch of the aorta. Did you guys get it? Okay. Okay. So now we mainly is okay have the two major sets of blood vessels that are going to just okay form what we call the circle of Willis. Did you guys get that?
Yeah.
Okay, guys, let me just see one thing. Here we go. And for those of you who are confused, this is going to be okay an inferior view of the brain. Okay. Now what we have here is one vertebral artery and another vertebral artery. Okay, we can mainly say it's okay. If it was, this would have been yes, okay, your foramen. Oh, sorry. This would have been yes, okay, your foramen magnum. Where you mainly can see that. Okay, yes. One vertebral artery and the other vertebral artery pass through that, unite to become what we in this case is okay, we refer to as the basilar artery. And this structure here will be the pons. Where we mainly is okay have the pontine arteries. But this part here, guys, was going to be okay. What we're going to say is what will be the vertebral basilar network. Now, what we already have said is okay, where did these vertebral arteries come up from? The subclavian arteries. Now, here we see this fellow here, or this fellow here, internal carotids. But where did these internal carotids come from? They came from the common carotids. That's okay, not relevant here. But this common carotid also gave off another plant that we call the external carotid artery. Okay. But where did these common carotids came from? Now, this is the left. That branches directly off the arch of aorta. And this is the right common carotid. Internal carotid. Well, okay, it came from the internal carotid, but also came off, yes, okay, the common carotid artery, which in this case is okay, will come from the basocephalic trunk, which came off the arch of aorta. Okay. So whether it is this or these common, yes, okay, internal carotid arteries, or whether it is the vertebrobasilar network, they now together are going to form this wander here, which will be yes, okay, our circle of Willis. Did that make sense?
Question. So the internal ones, they go inside of the brain, and then the external ones just supply the outside of the face and
And neck.
the neck.
Yeah.
Okay.
Okay. So of your carotid, which is going to just okay play a role in the formation of the circle of Willis, is going to be an internal carotid. Clear? Okay. Okay, guys. So we said that we had the internal carotid. So that's going to be as okay. Internal carotid coming from the right. And that's going to be as okay, an internal carotid coming from the left. Did you guys get that? Okay. Where did this internal carotid come from? It came off from the common carotid, which is okay. On the right would have been coming off from the brachiocephalic trunk, and left arch of aorta, where okay, the brachiocephalic trunk would have been branching off the arch of the aorta. Now, guys, what this common carotid, internal carotid artery, I mean, is going to do is it's going to, yes, okay, mainly give off two branches in the brain. Right. One is going to be what we'll call the anterior cerebral artery. So if we take it, it's going to go like this from each side. Okay. Another branch of the internal carotid artery is going to be, yes, okay. Please keep in mind that's going to be on both sides. Or will be, yes, okay, what we'll call the middle cerebral artery. Did you guys get that? Yes, guys. Please say something.
Yes.
Okay, good. Okay. So for now, we can make this as okay. This was made as okay. What the carotid system was going to give us. A carotid part of okay as the circle of Willis. Okay. We had the internal carotid, which on each side okay will give off an anterior branch called the anterior cerebral artery. And another branch which is going to be the middle cerebral artery. Now, guys, as we said, we had the vertebral arteries, right? Yeah, okay. Let's make them a little bit down so we have some space. So we had our vertebral arteries. Okay. But we just said there's nothing new here. They were going to yes, okay, unite to form the basilar arteries. Okay. What we also said was that okay, yes, this basilar artery, yes, okay, was going to give off just okay these branches here. which we call the pointron arteries. Okay. What we can mainly say is okay that this is okay altogether form is okay what we call the vertebral basilar network. Now further up, what this basilar artery here is going to do. Now it's going to branch into yes, okay, a whole bunch of arteries and so on. So, but we are mainly yes, okay, just going to yes, okay. I guess it's okay. Keep our focus on yes, okay, what's going to form the post circular Willis. Okay. So ultimately, yes, okay, at some point, this basilar artery here, which was formed by yes, okay, the union of the two vertebral arteries, again is going to split into two branches. And the two branches that we mean is okay, we'll talk about here. That's going to be okay, what we'll call the posterior cerebral arteries. Right? Cerebral. So if you look now, what do we have? We have anterior cerebral arteries. We have middle cerebral arteries. And we have posterior cerebral arteries. Although it's okay, not much of our interest, but just if you guys want to, well, okay, yes, this will also give off some branches like these, which will be yes, okay, the cerebellar arteries. Okay. So now, guys, we just have to complete the cycle. Okay. And what we mainly as okay can say is that your right and left anterior cerebral arteries, they're going to be connected together by a branch, which is going by an artery that's going to be called the anterior communicating artery. So what is this anterior communicating artery going to do? We can mainly says, okay, its job mainly is going to join or make a communication between the right and left anterior cerebral arteries. Did you guys get that? Okay, but when it comes to his number, it's okay. That's only going to be one anterior communicating artery. Me is okay, just in between the right anterior cerebral artery and the left anterior cerebral artery. Did you guys get that?
Yeah.
Where now we can say it's okay. What is left is, let's see. That is going to be as okay. Another set of arteries, as a matter of fact, also going to be what we can call as okay, communicating artery. The main is okay is going to connect between the middle cerebral artery and your posterior cerebral artery. And these communicating arteries here are just going to be called the posterior communicating arteries.
Can you just repeat where they connect again, the posterior communicating artery?
My dear, it's obvious. And that's why it's okay. I wrote everything in color and drew everything in color. It's just going to be artery that connects the middle cerebral artery to the posterior cerebral artery. Okay. But here it's okay. You can say it's okay. They're going to be how many? You're going to have two, because they're going to be a right and a left. Posterior communicating artery. Where as far as your anterior communicating artery, there was only one, which was meaning it's okay, just going to connect there. Right anterior cerebral artery to the left anterior cerebral artery. And what do we have now? This structure here is what we mainly can say is okay, forms the circle of Willis. Did that make sense? Did that make sense, guys?
Yeah. So now
Yeah.
this entire structure is now the circle.
Exactly. Okay, so what do we have from the internal carotids, which came from the common carotids, which respectively is okay on the left came from the arch of the aorta, or from the right came from the brachiocephalic trunk, which came out of the arch of the aorta. Do we have the internal carotid? Okay. That enters into is okay, the skull through is okay, what they call the carotid foramina. Okay. Peace be with that. Okay. And that's okay. Then gives off what becomes the anterior cerebral artery and the middle cerebral artery. Okay. Your right and left anterior cerebral artery coming off on the right internal carotid and left internal carotid are connected together by a communicating artery called the anterior communicating artery. Did that make sense? Okay.
Yes.
Now, we said we had our vertebral arteries. But if you want to go, it's okay, even further, because okay, where did these vertebral arteries come from? They came from the subclavian arteries. Okay. The only thing that was different between the subclavian arteries was the origin from the arch of the aorta. Because the left directly branches off the arch of the aorta. The right branches off the brachiocephalic trunk, which branches off the arch of the aorta. Okay. But what the subclavian arteries did was they gave off arteries that we call the vertebral arteries. These vertebral arteries passes through foramen magnum, and after doing so, it's okay, unite to become a common branch or become a common artery known as the basilar artery that runs anterior to the pons. And as it runs by the pons, it's going to give off branches known as the poncine arteries. Further up this, okay, but we can mean it's okay, this is how it's okay, what we call the vertebro-basilar network on the vertebro-basilar arteries. Mainly it's okay, was made by the union of your vertebral artery to become the basilar artery. But this basilar artery further up is going to just okay, again split to become or give off what we call the posterior cerebral arteries. Okay. But we mainly as okay need to as okay make connection between these streets here. And that's why there's going to be as okay communicating arteries. So anterior is okay, anterior communicating artery between the anterior cerebral arteries from the right and left were united. Okay. Whereas okay, when it came to the middle cerebral arteries, they would now need to just okay get connected to the posterior cerebral arteries. And that connection between the middle cerebral arteries and the posterior cerebral artery is going to be through the posterior communicating artery. Did you guys get that? Okay. Now, what we made is okay, can say that okay, yes, your little branch that's going to be given off by the common carotid artery. Is going to be as okay, what we'll call the ophthalmic artery. Did you guys get that? And mainly as okay, a branch that's going to as okay be given off your middle cerebral artery. will be as okay, what we call the anterior carotid artery. But ladies and gentlemen, this thing here is the eighth wonder of the world. Just think of it, guys. Let's just say now we can pretty much okay block any artery. You can block this artery here. Right? Okay. But what that mainly is okay, but since it's okay, because the blood is going to be okay, circling around in this circle of Willys. So it's okay, your brain is still going to be, hopefully it's okay, receiving it's okay, the optimal amount of blood. You can even say it's okay, even if this one is blocked. Well, okay, as blood may not flow here. Well, it's okay between these two, but it's okay, you still get blood here. Okay. So it means it's okay, ensure you can say it's okay, a good circulation of blood to your brain. Now, in all this, guys, now you may have heard me, it's okay, when we talk of the endocrine system. I'm referring to as okay, a pituitary gland. It's going to be here. That's means it's okay, where we're going to have that cellular in the what the hell do we call that? In the sphenoidal bone. So guys, this was your circle of Willys or cow. Any questions? Or we can actually, it's okay, try to look at it here together. And you guys see this PP?
Yeah.
Good. So what do we have? Okay, let me just, where's Mr. Mouse? Mickey Mouse. Okay, good. So, your basilar artery. Where did the basilar artery come from? Your vertebral arteries, your pontine arteries. I say, okay, don't worry about this one here. It's okay, the superior cerebellar artery. That's me going to be as okay, related to the cerebellum. But ultimately, it's okay, this basilar artery will give split off into two posterior cerebral arteries. Okay, but this thing is okay, and okay, of course, it's okay with the vertebral artery will make the vertebral basilar network. We had our internal carotids. Where did they come from? The common carotids. Where did the common carotids come from? Right off brachiocephalic trunk, left, right, are directly off the arch of the aorta. Okay. But what that would do is give off middle cerebral arteries and the anterior cerebral arteries. Your right and left anterior cerebral artery are going to be connected through what you call the anterior communicating artery. Your middle cerebral arteries and your posterior cerebral arteries are going to be connected together through posterior communicating arteries. So this thing here is your circle of Willys. And as I just said earlier, well, okay, what we had from your middle cerebral artery is going to be okay, and anterior choroidal artery. Okay, and from okay, your internal carotid artery is going to be okay, this ophthalmic artery. Okay, but generally, it's okay. This is your circle of Willys. Okay, made up of or contributed to by two systems of blood vessels, if you want to put it that way, the vertebrobasilar and the carotids network. But it's going to mean it to be the internal carotid that provides blood to that. Did you guys get that?
Yeah.
Okay, guys. Now, one thing that is of, we can say, clinical importance, okay, is going to be, now, some of you may have heard of it, but some of you is okay, maybe is okay, a completely new term. But that means that's okay, something that we call an aneurysm. Have any of you ever heard of an aneurysm?
Yes.
Okay, Susan, do you mind tell us what do you, or what can you say about an aneurysm?
So I believe they are like something in like I want to say they're blood clots in the brain that I think that's what aneurysms are. But it affects the brain and eventually, the person can pass away from it. That's what I get from it.
Okay. Now, dear, okay, well, thank you for the answer, but let's put it this way, dear. Your aneurysms are not blood clots. Okay? Okay. What we can say is that what aneurysms may lead to is going to be an increased risk of formation of blood clots. Okay, but with that said, that's not why they are clinically important. Now, what an aneurysm is going to be is mainly going to be weakening in the vessel wall. Did that make sense? Okay. Now, primarily, a weakening in the vessel wall is going to be a weakening in the tunica media. Now, what may happen then? Now, due to an increased pressure in the arteries, which we call a high blood pressure. the blood vessel will stretch. And what we mainly as okay will end up is okay, there's going to be as okay defects in the muscular layer through which most likely as okay your tunica intima is going to herniate through that. Or you actually as okay have pouching in the blood vessels. And those pouches due to weakness in the vessel wall is what you call an aneurysm. Okay, now I pretty much okay provided arteries with the strength to be able to withstand as okay that high pressure within arteries was the thick muscular layer. That is not doing the optimal job here. So what may actually is okay protrude, or you can make this okay the vessel actually is okay may just swell up because of okay an increased pressure. Just like a balloon. If you play with a balloon and blown air into it, check the air out, blown air into it, and what do you start seeing? Something that may look like what you girls will call stretch marks. Right, okay. And what are those stretch marks? They are going to be as okay weakening in the balloon. And ultimately, it's okay, what would that weakening lead to? That if you blow too much air into it, it will go to say pop. Okay. So two areas, yes, okay, where we will or may find aneurysms can be in the cerebral arteries. Okay. Okay. And what can we say is okay that these aneurysms will be? You can make it as okay due to weakening in the blood vessels walls is there and out pouching of the vessel. Now, if you for instance say it's okay that we have a blood vessel where there's going to be as okay a weakening, weak area in the vessel wall. And what may happen is that deeper layers of the wall, of the vessel wall, prime is okay, things such as okay, just your tunica intima, which is a very thin membrane. It's okay, will pouch out. Or even as okay, due to this weakening, what may even happen is that okay, as the vessel itself may start to dilate. And either of these, that's okay, is going to be referred to as an aneurysm. Okay. Now, two, yes, okay, clinically, yes, okay, important areas, yes, okay, where you'll find this can be in the cerebral arteries. Okay. Common area, yes, okay, in the brain, yes, okay, where we find cerebral arteries is going to be, yes, okay, at, you can say, okay, the junction between the anterior cerebral arteries and anterior communicating arteries. So at that point, yes, okay, where we have, for instance, an anterior cerebral artery, and let's say it's okay, the anterior communicating artery. This point is common in the brain for development of aneurysms, or we can call cerebral aneurysms. Did you guys get that?
Yeah.
Good. Now, ladies and gentlemen, another point, another area in the body is okay where we may find aneurysms is the aorta. Now, in the aorta, there is mainly as okay two common points or two common areas of the aorta where as okay aneurysms may be found. Mostly as okay in parts of the aorta. And the abdominal aorta. Okay. As a matter of fact, it's okay, this abdominal aorta aneurysm may actually, it's okay, be referred to as AAA. That's a slang. Okay. So if you hear somebody talking about, okay, a patient with, okay, as a AAA or an EEE, okay, abdominal aortic aneurysm. And just think it's okay if this fellow here bursts. That's okay. That's a mess. That's a mess. Okay, guys. Do you guys have your popcorn?
Yeah.
Cold drinks ready?
Yep.
Okay, because we can just watch a small little movie. Choose share. Sorry. Let's go here. Oops. Here we go.
This is Dr. Cal Shipley with a review of the circle of Willis, Berry aneurysms, and subarachnoid hemorrhage in the brain. To begin, let's take a look at the anatomy of the circle of Willis. The circle of Willis is best seen by examining the underside of the brain. The circle of Willis is really a beautiful piece of anatomy and represents a central hub from which radiates the entire blood flow to the brain. Inflow is primarily via the internal carotids and vertebral arteries. Outflow of blood from the circle occurs via anterior, middle, and posterior cerebral arteries, each with left and right branches on either side of the circle. The basilar, posterior communicating, and anterior communicating arteries complete the circle. By merging the inflow of blood to the brain from the carotid and vertebral arteries, the chance is minimized that an obstruction or impairment in flow in any one of these arteries will result in a significant impairment of blood supply to the outflowing arteries. Now that we have a better understanding of the anatomy of the circle of Willis, let's take a look at how it contributes to subarachnoid hemorrhage in the brain. While beautiful in design and function, the circle of Willis is also the location of 85% of all aneurysms within the brain. One common site for the occurrence of an aneurysm is the junction between the anterior communicating and anterior cerebral arteries. Aneurysms form as a result of an acquired structural weakness in the blood vessel wall. Arteries which carry very high flows, such as those in the circle of Willys, are thought to be particularly susceptible to mechanical damage in the vessel wall. Contributory factors such as cigarette smoking or high blood pressure may accelerate the process of damage to the vessel wall. The strength of the aneurysm wall is inversely proportional to its size. Lesions 1 centimeter or larger are particularly susceptible to sudden increase in growth and rupture. With rupture, blood spreads rapidly across the surface of the brain via the cerebral spinal fluid. Bleeding generally only lasts a few seconds. However, rebleeding may occur and is most likely within 24 hours of rupture and initial hemorrhage. The most common cause of death and disability after subarachnoid hemorrhage is vasospasm, extreme narrowing of the arteries with impairment of blood flow to brain tissue, and subsequent stroke. Vasospasm usually occurs within the first 3 days after hemorrhage and generally peaks in effect about 1 week out. Vasospasm occurs as a result of chemical irritation of blood vessel walls by breakdown products of hemorrhaged blood. The duration of vasospasm and the location of the vessels affected determines the size and depth of subsequent strokes.
Okay. So, now as far as bleeding in, or let's say it's okay, around the brain, subarachnoidal hemorrhage, or SAH. Okay. Then you have something like subdural. Now that's pretty much due to fracture of the skull. Okay. But it's we can say it's a closed fracture of the skull where you can say the skin will still be intact. That's that you have bleeding from the fracture side, from the skull into the area by the dura. Okay. Which means it's going to be a hematoma. Okay. So epidural hematoma. If that hematoma grows, it will put a pressure on the brain. Okay. But it's we can say it's the bigger the aneurysm, the greater the risk of it popping or rupturing. So any questions, guys? Now, ladies, as far as as the circle of Willys is concerned, this was all that I could offer. Okay. Now just take a break, and what I will be doing is sending out the notes that you may need, and some diagrams that you can look at as well. Okay. Did that
Thank
make
you.
sense? So I
Yeah.
see you guys back at, should we say, 11:05?
Thank you.
Okay, no problem. And did everybody receive the email?
Yeah.
Okay,
Yes.
good bit, good bit, good bit. Now, ladies, let's just continue. Sure. Okay. Nope. Okay. Now, let's go on to our next topic. And that's going to be blood supply of the upper limb, or if you don't want to call it a limb, you can call it the extremity. Okay, guys? Now, just before we go into that, please keep in mind that this, which is armpit, will be referred to as the axilla. We can say, yes, okay, this will be your shoulder. This is going to be, yes, okay, what we'll call the upper arm. The word for upper arm is going to be brachii. Oops. We'll have the elbow called the cubital. And then we will have what remain as, okay, just we'll call the forearm. After which there will be, yes, okay, your wrist. The hand. And then it's okay, of course, your fingers. Okay, guys. So if you are not clear about, it's okay, these areas here, it's okay. Especially, it's okay, people confuse upper arm and forearm. So what is going to be proximal to your elbow is going to be the upper arm. Whereas what is going to be distal to your elbow is going to be your forearm. Okay? Did you guys get that?
Yes.
Good. Okay, guys. And mainly Asoke starts off again, yes, okay, at our parts of aorta, where we had the brachiocephalic trunk, we will have the left common carotid artery, and we can see the left subclavian artery. Likewise here, because we have the right common carotid artery, and we have the right subclavian artery. Okay. Now, for the blood supply of your upper limb or upper extremity, well, it means going to start from your subclavian artery. Where that's on the right side or the left side. Okay, and I hope by now, all of you know that the origin of the subclavian arteries differs from what we call the right or left. But pretty much, what happens to it afterwards is going to be the same, whether we talk of the right or left. Now, guys, an easy way to get through this is that we can say, the subclavian artery mainly will become what we'll call the axillary artery. Whether that was on the right side or left side. So if you look at the word axillary, that should be obvious why we call it axillary artery. Because it runs in the axilla. Okay. After which, now physically, it's mainly just the continuity of the artery, but mainly it's going to change the name because it goes into different regions. So what was the axillary artery? Ultimately, will become what we call the brachial artery. Okay, and why brachial artery? Because that's mainly going to run in the upper arm. Ultimately, by the elbow. What your brachial artery is going to do is it's going to bifurcate into two major branches. One called the radial artery, which is going to be lateral and the other one called I'll show you the different colors. Wider scale. Ulnar artery, which is going to be medial. Lateral and medial veer. In the forearm. Did you guys get that?
Yeah.
Good. Now, ladies, and okay. As far as okay, that's what happens in the wrist and beyond. Clear, okay. As far as okay, what happens in the wrist and beyond. You don't necessarily, it's okay, need to worry about that. Okay.
I have a question.
Okay.
So from the top, the subclavian arteries are stemming off of the vertebral arteries, like they're
No,
branching to
no,
those.
why would this branch off the vertebral arteries? Where did you get that from?
I think I mixed myself up in the
Okay,
notes.
I don't know. The vertebral arteries come off the subclavian arteries.
Right. And then
Your subclavian arteries come off either the arch of aorta or the brachiocephalic trunk.
okay, but the subclavian is branching into those vertebral, like from the left
No,
and the
it
right
gives
side.
off the vertebral arteries.
Okay,
The
it just
vertebral
gives.
arteries is going to be a branch of your subclavian arteries. Okay. Okay, so guys, what happens in the wrist and hand and fingers? Well, okay, don't necessarily need to worry about that. Okay. Now, ladies, just look here. So pretty much, okay, as if you look at this, this is the major blueprint of, yes, okay, blood supply to your upper extremity. Because it's okay in the most simple form. We start off at the subclavian arteries. Now, please, I hope that you guys are clear about the origins of the right versus left. But after that, that's okay. It becomes the axillary arteries in the axilla. It becomes the brachial artery in the upper arm. At the elbow, mainly it's okay, what your brachial artery is going to do is split into two branches. Where one is going to be able to call the ulnar radial artery, which runs down laterally on your forearm, and the ulnar artery, which is going to run down medially on your forearm. And guy, literally, that's okay when you get to the wrist here. Now, this is medially right here. If you place your finger, you'll feel a slight tap. And that's going to be your ulnar artery. So this is going to be your ulnar pulse. Okay. Now, usually it's okay when you go to the doctor, or he or she is okay, takes your pulse, they're going to place their fingers here. Okay. And you'll feel a similar tap. Okay. And this is going to be as okay, your radial artery. So that will be your radial pulse. Did that make sense? Okay. Okay, guys. Now, pay a little attention, please. We said we had the arch of aorta, we had the brachiocephalic trunk, and off the brachiocephalic trunk here, so okay, was the right subclavian, and right off the arch of the aorta was the left subclavian. Okay. Now, what we may, or not what we may, what we will have is that there's going to be as okay a small muscle, as okay, relatively small muscle in the neck. Like this. Now this is going to be as okay what we can call the scalenus anterior muscle. Some people may even as okay also call it the anterior scalenus muscle. Okay. Well, what this anterior scalenus muscle does, it's mainly as okay going to run anterior to your subclavian artery. And what we mainly see is that, okay, due to that, this subclavian artery here, mainly as okay, will be, due to the scalenus anterior muscle, as okay, be divided into 3 parts. Proximal, what runs posterior to the scalenus anterior muscle, is going to be posterior. And then what runs over here is going to be distal. Okay. Now, as far as okay, as our subclavian artery was concerned, whether it's okay, the right or the left, it has a couple of branches. The one branch we already mentioned, let's put this way. Subclavian artery has a couple of branches. one branch would be what we already mentioned. The vertebral artery. So your vertebral artery main just branches off the subclavian artery. And as we just talked about, we know that it is going to be important in forming of our circle of Willys. Is that clear? Is that clear, guys?
Yeah.
Good. Now just keep in mind, why did we call the subclavian artery the subclavian artery? Meaning it's because we can make it that if this here was your clavicle or collarbone. Okay. Now, another branch that's going to branch off your subclavian artery is going to be a fellow here. And that is going to be now I may go under two names. It can be referred to as the internal thoracic artery. Or what they may also call it is going to be the mammary artery. Now, ladies and gentlemen, we said, this was clavicle. And here we mean it says, that we have, we have the sternum. This internal thoracic, now you look at the word internal thoracic, it pretty much tells you that it's going to be on the inside of the thoracic cavity. But if you say that, so if this here is, was your sternum, we can say it's, up here. Is your clavicle. We can mean it says, if this here is, was your subclavian artery. We can actually say that this will be your internal thoracic, or what we can call the mammary artery. Okay. And what you may come across is that, as this mammary artery or thoracic artery here actually is may be used as a bypass graft for your coronary arteries. That they actually, maybe it's just separate it off from the sternum, and but attach it onto your coronary artery and use that as a bypass artery. Okay, this is most likely going to be done for us for the left side of the heart. That but only if it's viable. Okay. Okay. Why? I mean, yes, okay, because you want to ensure that, okay, the left side of the heart gets the best bypass graft. And arterial bypass grafts are better than venous. Let me, yes, okay, graft a vein and use that, just okay, run the bypasses. Did you guys get that? So in some instances, okay, you may come across that, okay, the internal carotid one end, not internal carotid, internal thoracic artery. One end of it is going to be, okay, attached onto the heart. And that's mainly because they used it as a bypass graft. Did you guys get that? Okay, so we can say it says, okay, clinically important, yes, okay, branches of your subclavian artery, vertebral artery. Why? Because it was going to just, okay, participate in the production of the circle of Willis to become, yes, okay, the basilar artery branching off to the posterior cerebral artery. Okay. Bilateral branch of your subclavian artery was going to be, okay, the internal thoracic, also known as the mammary artery. Why was that important? Because, okay, that could be used for coronary artery bypass. Okay. In the course of the subclavian artery, what did we have? We had a small muscle running anterior to it, meaning it's, okay, dividing it into three parts. A proximal part, the posterior part, mainly because the muscle runs anterior to the artery, and a distal part. Did I make myself clear?
So, so the subclavian artery gives off the vertebral artery, which participates in the production of the circle of Willis.
Yes.
And the internal thoracic artery or the mammary artery, which is important because it could be used for the coronary.
Exactly. Okay. Right. And literally, guys, well, okay, where does the internal thoracic or mammary artery runs? Right. Yes. Okay. If this is the sternum, this is the anterior surface of the sternum, and this is inside of the thorax. It runs down the sternum just like this. Okay. Or what we mean refer to as it runs retrosternally, which mean just behind the sternum. Did you guys get that? Okay. Now, guys, as I said earlier, so you mean it's okay. So what did the subclavian artery do? It gave off the vertebral artery and the internal thoracic artery. Now, if you guys look here, I say, well, physically, and that's why I say physically, it's going to be the same artery that continues, but then it all of a sudden, yes, okay, changes its name from the subclavian artery to the axillary artery. Clear? Okay. Okay. Did you guys get that? So let's look at it in this way. Arch of aorta. We can say it's okay. Clavicle. And under the clavicles, what's going to be that's okay, your subclavicular arteries. Okay. What we know is that, okay, yes, here in the middle, yes, okay, they're going to, yes, okay, articulate onto the sternum. Now, guys, what we have here. On both sides is going to be your first rib. And what we mean, you can say that, okay, yes, at the lateral border of first rib. That's why it's okay. Or previously it was the subclavian artery changes its name and becomes the axillary artery. And of course, that's okay, guys. There should be no doubt about it. That okay as this. Sorry, first rib is going to just okay, come and okay, it's okay. In the front, it's okay, articulate with the sternum. Okay. But the point where is okay, the subclavian artery crosses by the lateral border of the first rib. That's going to be okay where it physically it's okay continues, but it's just going to just okay change its name. Did you guys get that? And what's going to be the new name that it will go under is going to be the axillary artery. Okay. We can mean that's okay. The lateral border of first rib. Now, guys, another important point. And we said, okay, so this is okay, was your axillary artery, which pretty much okay runs in the course of this, okay, your axilla or armpit. Now that means that's okay going to be a muscle here as well. And pretty much okay as a muscle that comes from your upper ribs. And runs like this, and out here is okay, it's going to be it's okay. We can see it's okay attached to the humerus. But this muscle here is going to be okay, what we will call the pectoralis minor muscle. Okay. And this pectoralis minor muscle is still going to be running anterior to the what we call the axillary artery. And now remaining, it says, due to this pectoralis minor muscle here, our axillary artery is divided into 3 parts. And again, proximal, posterior, and distal. Just give me a second. Okay, sorry guys. Okay. Now, now somebody may also call this proximal part of the axillary muscle or axillary artery first, the posterior second, and the distal third. Okay, guys? Now, the first part is going to give off one arterial branch. But don't worry about that one. The second part, or the posterior part of your axillary artery, is going to give off 2 branches or 2 arteries. Don't worry about that one either. The third part or the distal part of the axillary artery is going to give off 3 arteries. And one of them is don't worry about it. Its mean is there's going to be 2 branches that we mean is we'll talk a bit about. Which branches off from the distal part or the third part of the axillary artery. And they are going to go under the names respectively anterior, circumflex, humeral artery. So if you say that, if this fellow here is was the humerus, the bone in the upper arm, there's going to be a branch of your axillary artery that was going to run anterior and circle around the humerus. Whereas the other branch of this third part or distal part of the axillary artery was going to give off another branch, which means, okay, this will be the posterior circumflex humeral artery. Now, what does the word anterior and posterior mean? In front and in back. In front and back of what? The humerus. The word circumflex mainly means that's okay to circle around. Okay. And what we actually is okay, will see is that, okay, yes, that your anterior circumflex artery, anterior circumflex humeral artery, and your posterior circumflex humeral artery are going to do is they're going to just okay meet end to end. And that end to end union of arteries is going to be known as nothing but an anastomosis. Okay. So your anterior circumflex humeral artery, which ran anterior to the humerus and circled around, and the posterior circumflex humeral artery is going to just okay run posterior. At some point, yes, okay, they're going to meet end to end in what will become an anastomosis. So we actually have okay as an anastomosis. Literally, that's okay. We just look at the humerus that anastomosis is going to be. There will be okay, your anterior circumflex humeral artery, and okay, yes, the posterior circumflex humeral artery. So they're going to just okay, anastomosis around is okay, what we call the neck of your humerus. For this part of your humerus, okay, that's going to be the head. That's going to just okay articulate with your shoulder blade. Okay. And okay, deeper to that is going to be just okay the shaft of the humerus. Did you guys get that? Yes, no, maybe.
Yeah.
Now, does anybody have any questions? Yes, ladies and the gentlemen. Anybody have any questions?
I have a question.
Go
So
ahead.
that's the anterior circumflex humeral artery and the posterior are anastomosis. Is the left subclavian vein and right subclavian vein one as well? Because don't they they turn into the, what is it, the brachial? No, not the brachial, the I'm drawing a blank. The hold on. The basilar artery.
No, my
Would
dear.
that-
No. You listen there. Where did your basilar artery go? Okay, listen. You had the vertebral arteries on both sides. But they are going to go in through the skull and then become, it's okay, the basilar artery. Okay, right now we are not in the head, we are at the shoulder.
But isn't an anastomosis, isn't it like a connection between?
Yes,
Yeah, but don't they connect? The two
exactly.
parts of the vein connect?
exactly. No,
So-
not an artery and a vein. When an artery and a vein directly connect like that, that's going to be a fistula.
I meant to say artery. I meant to say the subclavian artery. They connect on each side and then turn into the basilar. So wouldn't that be an anastomosis where they connect or no?
You can put it, yes.
Okay.
You can say it that way as well. Yeah.
Okay.
Okay, you can say that the right and left vertebral arteries will meet ancient bias. Okay, the reason that we may not refer to that as anastomosis because, well, okay, they come and then when they meet, that's okay, that part of, okay, as the union continues as a basilar artery. Okay, they are more like, as I will call it, an anastomosis. Okay, I come from here, you come from here, dump. Like something like this. That would be more of, okay, as correctly stating an anastomosis. Did that make sense there?
Yeah.
Okay. So you can make it as okay, come together, or yes, okay, unite. But then, okay, what happens as a result of, okay, that they form, okay, a common vessel, which will be the basilar artery or your vertebral arteries. Okay, mainly as okay because you already said, okay, we had an anterior circumflex humeral artery, and we have a posterior circumflex humeral artery. But when they meet end to end. Okay. Now what they do is they made it, okay, form this anastomosis around the neck of your humerus. Now, why is that important? Why did out of all the branches, why did omit all the other branches and talk about this one here? Well, okay, first of all, it's okay when we have an anastomosis, mainly going to say, well, okay, if one of these blood vessels is okay, is either inked or blocked or is okay or compressed or so and so, then you still have okay as a good circulation around it. Okay. Okay. But this is also as okay, more likely as okay to be, you can say, damaged. This anastomosis around the neck of the humerus may be damaged in case of, it's very rare for us, okay, the neck of the humerus to fracture, but okay, most likely is okay, subluxation and so on, so that actually may get kinked or it's okay, trapped. Okay, so pretty much okay due to that. Okay. But yes, okay, guys, the main thing that you guys will need to remember is, okay, is which arteries or which artery is it that your circumflex humeral arteries arise from? Axillary artery. Okay. Did you guys get that?
Yes.
Good. No, guys. And that's why I says, okay, it's very easy. If you mean it's okay, just make a flow chart like this. Because, okay, as you saw, well, okay, the axillary artery, although it's okay, that's a physical continuation of the subclavian artery. Whereas, okay, at some point, well, okay, it's going to change its name. Okay, there's going to be some point at which it is going to change its name. Okay, although guys, that's okay. When you're scanning, you're going to say, okay, subclavian artery, you mean yes, okay, continued. Okay, yes. Now you're looking at the brachial artery, axillary artery. That you mean yes, okay, just continue, and okay, as at some point, okay, yes, it will be referred to as the brachial artery. Okay, so again, it's okay, just like okay, that between the subclavian artery and your axillary artery, he says, okay, the anatomical landmark for that separation, or for that point where it's okay, your subclavian artery becomes the axillary artery was the lateral border of the first rib. Likewise here, the point that's going to just okay mark, because it's okay, the end of the axillary artery. And we can say it's okay, the beginning of the brachial artery is going to be a muscle that's going to be called teres major. Did you guys get that? So pretty much here, there's going to be a muscle called teres major. After which, well, okay, physically, yes, okay, it's the same muscle, sorry, same blood vessel that continues, but now is not called axillary artery, meaning because it leaves the area of the axilla, and now, yes, okay, is running in your upper arm. And that's why, yes, okay, it's called the brachial artery. Did you guys get that? So let's just make our Arnold Schwarzenegger here. And of course, it's okay, Arnold Schwarzenegger got big biceps. It's arch of aorta. Brachiocephalic trunk. And okay, here's the subclavian arteries. First rib, or we can mean that's okay, the lateral border of the first rib. And where was this brachial artery? Now, subclavian artery now becomes axillary artery. Okay. He may be big with big biceps, but okay, yes, he has we can say it's okay, the teres major muscle. And and as it crosses that, it becomes the brachial artery. Now, the reason that I drew all this here is mainly so that you guys will be able to, yes, okay, realize where in the forearm, no, so upper arm, sorry, is it that the brachial artery is going to be running. And okay, yes, brachial artery. Because ladies and gentlemen, in all this, we can mainly say that, okay, yes, this here is mainly, yes, okay, going to be your humerus. So what do we see? That the brachial artery, well, okay, yes, it runs in the, or we can call this, okay, the upper arm. And the term for this part of your, yes, okay, upper extremity was brachii or brachii. That's why they may just, okay, call it a brachial artery. Okay. But it's going to be, we can say, medial to the humerus. Did that make sense? Did you guys get that? So whether you're Arnold Schwarzenegger or not, okay, but pretty much, okay, it's going to be running right anterior to your humerus is going to be your biceps. So where do we have it? Literally, guys, now this is the medial surface of my upper arm. And your brachial artery will be running here, like this. And up here, by the elbow, the medius, okay, will come up like this. And ladies and gentlemen, if you feel right here, you should be able to feel a good, solid tap. And what would that be? That would be, yes, okay, what we call the pulse of the brachial artery. So right anterior medial of your elbow joint, right here. I can feel it right now. And mine is very good. Okay. Well, okay, a good solid brachial pulse. Did you guys get that? In the course of your upper arm, ladies and gentlemen, your brachial artery runs medially. Okay, so when you guys will be scanning this, you come like this, axillary, and then to scan your brachial artery, you'll have to run the so that's okay down on the medial side of the upper arm, because that's mainly that's okay right there is okay where your brachial artery will be. Okay, that's why it's okay. It's important to so know the anatomy. Any questions at this point? So it's going to be running medially to the humerus, which is the main bone of your upper arm. Oh, you forgot the names of the bones. Where is this one here?
The distal phalange.
Oh, here we go. So not completely evaporated. Okay. See. Nice. Now, what ultimately, ladies and the gentlemen, is going to happen to your brachial artery. Now we said, okay, yes. It moves, yes, okay, slightly like this. And ultimately, yes, okay, it's going to give off, or we cannot give off, sorry, it's going to, let's be correct here. Bifurcate. Okay, it's going to bifurcate very much, okay, as anterior to your elbow into what will become a lateral branch, which is going to be the radial artery. And a medial branch. This is going to be the ulnar artery. Now, why radial? Because of the radius. Why ulnar? Because of the ulna. Is that clear? Did you guys get that?
Yeah.
Good. Okay, guys. Now let's just do it this way. We can say we're just going to look at one arm of Mr. Schwarzenegger. And just so we know what we are talking about, we can say, okay, we have our humerus. We can say that, okay, as here we have the brachial artery. Okay, so what do we have? We can say, okay, this is going to be the lateral side. And this is going to be, it's okay, the medial side. Now, one artery in your upper extremity, or we can say it's going to be okay, important for your brachial artery scanning, that you may have to find, is that up here. That's okay, the brachial artery is going to give off this branch. And this artery here can go under two names. It can be called the deep brachial artery. Yeah, okay. Or it may also be called the profunda brachii. Or if you don't like it, you can also call it the profunda brachial artery. Did you guys get that? Now this profunda brachii, or deep brachial artery as we call it, is going to run posterior to the humerus. Okay. That's why I mean it's okay, just made it dotted. That's going to be as okay. Run posterior to the humerus. In a groove called the radial groove. Okay. Now some of you say, well, radial, isn't that pertaining to radius? Which would have been down here. So why do they call this fellow here the radial groove? And that's mainly, guys, because in this radial groove, along with just, okay, the deep profunda, or the deep brachial artery, or the profunda brachial artery, is going to be as, okay, a nerve called the radial nerve. So mainly because the radial nerve runs in this groove, that's okay. Strange enough, that's okay with the brachial arch or deep brachial arch or profunda brachii. That's why that is not named after the artery, but it's named after the groove of the nerve. Okay. Now, why am I talking about this? Because this is an area where the humerus is likely to break or fracture. And then you can just say, yes, okay, if it breaks or fractures right next to us, okay, where an artery or a nerve is running, what can that lead to? Damage to the artery and or damage to the nerve. Did you guys get that?
Yes.
Good. Now, ladies and the gentlemen, just take a brief lunch break and make sure you get something to eat, because you will need the calories when we come back. Okay?
Thank you.
No problem. So I see you guys, should we say at 1 o'clock? Is that fair?
Okay.
Have fun till then. See. Any questions? Nope. Nope questions. Okay, ladies and gentlemen. Let's see. Now again, we can say, what do we have? I'm going to make this a little bit small. And this is now going to be Popeye. Now here said, where we had the bone. That we call it humerus. Now medial to that, we mainly have, yes, what we call the brachial artery. Okay. Now what we know of what we have in the forearm, just to make sides clear here. That's the lateral side and the medial side. That'll be the chest. So in the forearm laterally, do we have, okay, as the bone is going to be called the radius, and medially is going to be a bone that we call the ulna. Right. Okay. Now, what we also earlier said was that our brachial artery gives off this artery that we call the deep brachial artery. Did you guys get that? Okay. And okay, that ran in our radial groove. Now, one thing that I want you guys to just realize here, guys, is that in the forearm, in between your ulna and radius, is going to be a membranous sheet. Okay. And mainly because it runs in between two bones here. That's why it's going to be called the interosseous. And mainly because it's just a thicker sheet of fibrous tissue that makes that it's going to look like a membrane. It's going to be called the interosseous membrane. Did you guys get that? So in the forearm, medially is the ulna, laterally radius. In between them is going to be a membrane called the interosseous membrane. Okay, it's pretty much is going to divide your forearm into, we can call it an anterior compartment and posterior compartment. Did you guys get that? Okay. So now what we also said was what your brachial artery is going to do. We said that literally that was going to bifurcate into two arteries. One will be what we call the radial artery, which means was going to run down alongside by the radius. And on the medial side, well, yes, we had an artery that we were going to call the ulnar artery. Did you guys get that? Now, did you guys get your energy? And we say, shitty day of the week, midday of the week, mid time of the day, energy level low. Okay, guys. Now, don't get frustrated, okay? Let me just try to make this as brief as possible. Now, guys, what your ulnar artery Okay, let's just make sure that we use every possible color. What your ulnar artery is going to do is find, yes, okay, give an artery off that runs like this. Okay, which we mean is okay. I mean it's okay because it proceeds towards, yes, okay, the interosseous membrane. That's why it's okay, we will call this fellow here the interosseous artery. Did you guys get that? Okay. Now, what the interosseous artery is going to do once it is, okay, gets to the interosseous membrane is going to just, okay, give a branch that runs posterior to the interosseous membrane. And since it does that, that's why we'll call that the posterior interosseous artery. Okay. But it's also going to just, okay, give a branch that runs anterior to the interosseous membrane, and that's going to be the anterior interosseous artery. If you say this here was the interosseous membrane, this is the interosseous artery branching off the ulnar artery. But when it reaches to the interosseous membrane, what will it do? Split into a branch that's going to run on the anterior surface, being the anterior interosseous artery, and a branch that's going to run behind the interosseous membrane, which is going to be the posterior interosseous artery. Did you guys get that?
I just have a question.
Yes.
Did the interosseous artery branch from the ulnar artery, or where did
Yes.
that? Oh, did
Yeah.
okay.
Exactly.
Okay.
Yeah, okay. That's why I tried to, yes, okay, somehow demonstrate here. So brachial artery terminates into the radial artery and the ulnar artery. Off the ulnar artery is going to be your interosseous artery. Okay, which when it reaches the interosseous membrane, split into two branches. One is going to be the anterior interosseous artery, mainly because it runs anterior to the interosseous membrane, and posterior interosseous artery. Okay. Or some people may also call them as, okay, the anterior branch of interosseous artery and the posterior branch of interosseous artery. Did you guys get that? Yes or no?
Yeah.
Okay, guys. Good. Let's just try to get up to, yes, okay, our profunda fellow here. This profunda, or deep brachial artery or profunda brachii is going to split off into two branches. One is going to be what we'll call the radial collateral artery. This is pretty much going to be the lateral branch of your deep brachial artery. And it's going to give off another branch, which will be the middle collateral artery. Or if we do it this way, we can make it that your deep brachial artery gives off two branches, radial collateral artery and the middle collateral artery. Did you guys get that? Now, guys, our brachial artery our brachial artery are going to give off two medial branches. One is going to be what we can call the superior. Now, since it's medial, that's why we may call it the ulnar collateral artery. And further down, the ulnar brachial artery is going to give off another medial branch, which is going to be the inferior ulnar collateral artery. Okay, guys. So what do we actually see that we have here? We got a total of 4 collateral arteries. 2 arising off from the deep brachial artery, 2 arising off the ulnar artery. Did you guys get that? Any questions? No questions? Good. Okay, my dear guys. Now, what we mainly will see. Now, let me just start from one side so that we don't get, let's say, too confused. Now, what your radial artery? We said this was okay as the radial artery because it was okay as a terminal branch of your, by the bifurcation of your brachial artery. What this radial artery is going to do is going to just okay give off an artery that actually is okay runs like this. I mean, it's okay because it's an artery that's going to it's okay run or make a U-turn, if you want to put it that way. That's why it's going to be referred to as being a recurrent artery. Okay. But this recurrent artery here, well, okay, it's a recurrent artery. Why do we call it a recurrent artery? Mainly because it makes a U-turn. Okay. But since it's okay, it branches off your radial artery, it's going to be referred to as the radial recurrent artery. Did you guys get that? Okay. Now it's not going to end up in a blind end like this. But what this recurrent radial artery actually is okay will do is anastomose with the radial collateral artery. So we can just add that info down here and say that, okay, yes, the radial collateral artery mainly is okay is going to anastomose with our radial recurrent artery.
Bread.
Got the buns?
Bread.
Okay, look in the, I don't know, I don't think so. Did you guys get that? So your lateral collateral, oh, it's okay. It's okay, your radial collateral artery and your radial recurrent artery are going to anastomose. Now, what we also saw was that, okay, yes, our deep brachial artery gave off another branch, or we can say, okay, gave rise to another collateral artery known as a middle collateral artery. Okay. Now, of course, that's okay. This is not going to end up in a blind end. So he or she also will have to anastomose with an artery. And ladies and gentlemen, what we actually have is we said that we had an interosseous artery which rose from the ulnar artery, which came from the bifurcation of the brachial artery. But this interosseous artery gave off just what we call a posterior branch. We're going to run posterior to the interosseous membrane, and it gave off an anterior branch, which was going to run anteriorly to the interosseous membrane. And what we actually is will see is that this posterior interosseous artery here gives off a recurrent artery. And again, it's why do we call it a recurrent artery? Because it makes a U-turn. Okay. And simply because it branches off the posterior interosseous artery, was a recurrent artery that branches off from the posterior interosseous artery. This is going to be referred to as the posterior interosseous recurrent artery. And that fellow here is going to, again says, anastomose with the middle collateral artery. Did you guys get that?
Question, it's the post inter, oh, I don't know how to say it.
Posterior interosseous membrane. Posterior
Interosseous.
interosseous artery, exactly.
The reoccurring artery, that's the in the blue where you drew
Yeah.
it? Okay. And that's stemming off of
The posterior interosseous artery. Okay.
Okay.
That's why we call it a posterior interosseous recurrent artery. What does it mean to be a recurrent artery? An artery that travels, but because it means as it branches off, it makes a U-turn. Yeah. Did that make sense?
Yes. Are you able just to pull that picture up for
I'm
one more
going up because I'm not done yet.
Okay.
There's still more to come, okay? Okay, dear. So just to make it simple, my dear, the middle collateral artery is going to anastomose by what we can call the posterior interosseous recurrent artery. Where did this posterior interosseous recurrent artery come from? It's a branch of your posterior interosseous artery. Okay, but we mainly call them recurrent because if this was an artery and we have as what you call a recurrent artery, it's going to branch off, but then it's take a course like this. Did that make sense? So mainly because, okay, it makes this U-turn, if you want to put it that way. That's why we called it a recurrent artery. Did that make sense?
Yeah.
Now, guys, we had the superior ulnar collateral artery. Which by itself, as okay, mainly as okay, was a medial branch of your brachial artery. We can say, okay, that we have the superior ulnar collateral artery. Okay. Now, what we see of the ulnar artery, what we have at the ulnar artery, okay, is going to be as okay where we're okay. It's also going to give off a recurrent artery or a recurrent branch. And this fellow here actually is going to be as okay what we call the posterior ulnar recurrent artery. So that's actually as okay going to run posterior to your elbow joint. Just because it's okay a lack of space here, it's okay. I'm just going to try it out here. But is going to just okay anastomose with your superior ulnar collateral artery. So that superior ulnar collateral artery is going to anastomose with what we call the posterior ulnar recurrent artery. Did you guys get that? So if we now look at it, guys, we're only left with one last recurrent artery. Oh, sorry, collateral artery, which is going to be as okay the inferior ulnar collateral artery. And what is it that he or she does? It's also just okay going to anastomose. Okay. And there actually is okay going to be a it's going to be okay a branch that okay also arises off the ulnar artery, which also is okay is going to recurrent. And what does it mean to be a recurrent artery? That it turns around. Yeah, okay. And okay, I know that we are going to be out of room here. So, but this one is going to be called the anterior ulnar recurrent. So that actually is okay, going to run, if you look at it, anterior to your elbow joint. Okay. But it's going to anastomose with your inferior ulnar collateral artery. So what we can mean is okay. So what you actually can see, ladies and gentlemen, that each of our collateral arteries or anastomose with their own recurrent arteries. Okay, guys. Off the record.
I have a question.
Yes.
So everything else that you've talked about today, though, is what is going to be on the final, but this is just for like our reference?
Yeah.
Okay.
No. Yes, guys. Why, you already have a headache? Well, okay, what I just mentioned off the record should be as okay as sigh of relief, right? That currently is okay, you don't have to worry about it. Hakuna Matata, right? Okay, but it's okay. I would say it's going to be criminal not to know that, okay, as the profunda brachii is a branch of the brachial artery. Okay, it's going to be criminal to not know that, okay, yes, your axillary artery leads into what becomes the brachial artery. Things like that. So if you don't know that, then okay, yes, I don't know what to say then. Okay. Okay, guys, but so as far as arterial supply of the upper extremity, also known as the upper limb, is concerned, we are done. So where did we start from? Subclavian artery. Clear? What did the subclavian artery become? The axillary artery. What's the landmark for that? The lateral border of the first rib. Clear? Okay. Then we go from axillary artery and it becomes the brachial artery. What was the anatomical landmark for that? The teres major muscle. Right? Brachial artery travels down the medial side of the upper arm. and bifurcates into what becomes the arteries of the forearm, which will be laterally the radial artery, medially the medial artery. Okay, guys? Okay. Now, one thing that you may have, yes, okay, I may have, yes, okay, think about as okay, be able to understand, because you're going to, yes, okay, become, yes, okay, make it easier for all of us when we get to the lower extremity, is that you understand the concept of the interosseous membrane. Clear? Did that make sense? That's not too much to ask, right? Or is it? What was the interosseous membrane? Mainly, it's okay, just a membrane that in our forearm runs between your radius and ulna. Clear? Did that make sense? Because yes, okay, guys, in your lower extremity on your leg, because you have, okay, it's a similar membrane. Okay. So is that too much to ask for? And some of you go, oh, shit, leg is going, just okay, leg is bigger. So more crazy network of blood vessels? No. Okay. So don't get a headache for the leg. Leg is very easy. Compared to this, peanuts. Sure. Okay, guys. Are you guys ready for venous drainage of the upper extremity? Very short. Okay. And you, yes, okay, guys, when you go for your scanning, that's okay. Our main emphasis is going to be on the arteries. Okay. So let's just look at our veins. Okay. If you want to put it this way. Now, what I said yesterday is okay, that we talked about, yes, okay, the extremities or limbs. What was it I said? That, okay, as we have two sets of veins. Right, okay. We have one set of veins, yes, okay, was going to be the deep veins. And what we made, yes, okay, could say about the deep veins was that they run side by side to the arteries. So you can say, it's okay, if you have an artery, next to that would be a vein. So that would be the deep vein. And if you say, okay, if this was the radial artery, this is going to be the radial vein. If this is the ulnar artery, this is going to be the ulnar vein. If this is the brachial artery, it's going to be the brachial vein. If this is the axillary artery, then it's going to be the axillary vein. Like that. Did you guys get that? Okay. But generally, it's okay, as I said yesterday, that okay. What we call these deep veins here is okay. They were also okay known as vena comitatus. Yep. Okay. Now, ladies and gentlemen, other set of veins that we have in the upper extremity was going to be what we call the superior veins. No, not superior. Sorry. Is going to be the superficial veins. Superficial veins. Okay. Now, guys, well, okay, they pretty much would start in the hands. Okay, this guy may have more than an extra finger, anyways. But the major superficial network of veins in your hand is what we have in the dorsum of the hand. So that is actually going to be what we here call the dorsal arch. Clear? Okay. The dorsal arch. Now, if you just look at Mr. Schwarzenegger, then we can say it's okay, upper arm. And forearm, and right now it's okay, our hand is in the anatomical position. So what we made is have on the lateral side. It's going to be a big vein. Okay. And he or she is going to be referred to as the cephalic vein. As a matter of fact, in every body, ladies and gentlemen, it runs right here. Okay. This is my wrist. This is my thumb. Right here. Most likely you'll find a big juicy vein. Okay. So that's going to be the cephalic vein. Remain just come from the lateral limb of your dorsal arch. Did you guys get that? Okay. And yes. It will either continue up like this. Now, guys, this area here is by your elbow. That's where we have what we call the antecubital fossa. Some people may not call it antecubital fossa, but just may call it the cubital fossa. So mainly the lateral superficial vein in your antecubital fossa is going to be the cephalic vein. Now, medially, on the medial side of your antecubital fossa is going to be another superficial vein that we'll call the basilic vein. Okay. Mostly, yes, okay. I mean, yes, okay, because it's somewhere, yes, okay, in the middle. There may be, yes, okay, another superficial vein that they call the, some people, yes, okay, just call it the median vein. Some people may also refer to as the medial cubital vein. Now, guys, you may wonder when you go, yes, okay, and for instance, okay, and need to get blood taken. Why is it that, okay, yes, they feel around in your cubital fossa? Because you can mean that, okay, the primary vein of choice is going to be that of the median vein or median cubital vein that they want to be able to locate and hit and obtain a blood specimen from. Okay. And you will say, yes, okay, well, you are phlebotomist, you should know where it is. Yes, okay. But as far as the superficial veins are concerned, the way that they run varies widely from person to person. Even as okay, if you look at the superficial veins on your right hand and left hand, right arm and left arm, they may vary, although yes, okay, you are the same person. Okay, so that's why. Anyways, okay, so what median cubital vein, yes, okay, will be doing is okay, can also actually give off branches that okay, yes, communicate with the, let's okay, meet with the cephalic vein on the lateral side or the medial, or sorry, the basilic vein on the medial side. Now, what we have on the medial side, we already know that we had an artery, and we call this fellow here the brachial artery. Now, with this brachial artery, yes, okay, was going to have, yes, okay, its own vena comitatus that we call the brachial vein. Okay. Now, ladies and gentlemen, what we actually will see is that this basilic vein, which is the medial superficial vein, is going to empty into the brachial vein. So we can maybe say that your basilic vein pretty much okay finishes off here by going deep and actually is okay empty into the brachial vein. So what we can say is that okay, the basilic vein now carries blood not only as okay brought by, okay, given to it by ulnar vein and radial vein, but also as okay is going to carry blood from the brachial vein or basilic vein. Okay, guys. Now, as this basilic vein, sorry, brachial vein, goes further up. And now actually as okay enters into what we call the axilla. It becomes axillary vein. Clear? Okay. And that is actually going to be the point where your cephalic vein empties into it. Of course, we can say it's okay that here is okay, the artery will just be referred to as the axillary artery. Okay. And ultimately, yes, okay. We have, yes, okay, our first rib. And as, okay, yes, what was the axillary artery? Passes, axillary vein, sorry, passes by that. It becomes the subclavian vein. Okay. So what's going to happen to the subclavian vein here? Well, okay, guys. We will talk of that on the last day of ENP, which will be Friday. Okay? But roughly speaking, yes, okay, this was mainly as okay, how you can say it's okay, clinically or it's okay, scanning wise, it's going to be important as far as the venous drainage or the veins of your upper extremity. Okay. So you guys will get 2 separate emails now. One for the arterial supply of the upper extremity, one for the venous drainage of the upper extremity. I hope everybody got their emails for the circle of Willys. Okay?
I have a
Yes.
question before we end.
Hmm.
So I know some of this stuff is in the book. Did you want us to look at all in the book or just focus on the notes that you're sending us? Like to
Well, okay,
study?
you can use the notes.
Okay.
Okay, yep. That's why. That's why I'm sending you the notes, so you can use that to read. Okay? Good. Any other questions? Nope. Okay, guys, I have some emails to send, so see you guys tomorrow.
Bye.
Okay? Okay, bye-bye, dear.
Thank you.
Thank you.
You're welcome.